just based on the number of questions, I know you're going to want to have just as much time as I do with this panel. And questions are still coming in, as you could tell right there. I also want to thank, and I haven't done it yet, the University of Buffalo and their wonderful support staff, which is not only behind the camera, but also in the sound room, and everything that you see here today in terms of the technical aspects is just really thanks to the efforts not only of Bill Regan, but the great support staff and technical staff of the University of Buffalo. I'm also an alumni here and from the law school here back in the 80s. I didn't even know, I don't think this building existed, but it's a wonderful addition to the Western New York community. Now, many people at the panel you've met before, some you haven't, but just to very quickly go through those you see, we have, of course, Dr. Paul Updike from Catholic Health Systems. Stacy Roeder from Kids Escaping Drugs is right next to Bill Bergen from Drug Dependency Services. At the very end, I see Dale Kasperzak making himself comfortable. And then the third person from the right is Dr. Kathleen Mylott. She's the Associate Medical Director for Independent Health. We have Frank Scarpinato from the Erie County Environmental and Planning Department. We have Dr. Chris Jaydock from Duville School of Pharmacy, and he bears a slight resemblance to Assistant United States Attorney Tim Lynch, don't you think? I've noticed that over the years. Sometimes a little levity doesn't hurt. And then, of course, you've already heard from Dr. Teresa Lawrence. And in order to perhaps get right to the first question we have, I will ask Frank Scarpinato, what is the proper handling and disposal of prescription drugs? One of the messages we heard, I think, consistently this morning and this afternoon was one of the common sense solutions is to lock the prescriptions, make them safe, make them secure. But then number two, when you don't need them, dispose of them. What is the safe way to do that, Frank?
Well, ironically, I have nothing to do with law enforcement, lawyers, pharmacies, medical. I'm a geologist. I started all of this simply for environmental reasons to keep pharmaceuticals out of our waters. And I got involved with this wonderful group, and I have to thank everybody for keeping me on board. Thank you. But the best way to handle this is to bring those items, and I don't care if it's controlled, non-controlled, over-the-counter, healthcare products, bring all of it down to our collection events. Now that we're working with the DEA, we're able to cover large areas on single days. We used to do single sites. Now Erie County on the 29th, a week from tomorrow, will have 14 sites in it. I could never have done that on my own or by myself. Bring all of those items down. We will incinerate them. They will not enter our waterways. They cannot get into your kids' hands. They can't be accidentally overdosing our elderly. Once you get them to our collection events, they will be destroyed. We have to comply with all HIPAA, narcotic enforcement laws, and state DEC laws. So these things are going to be handled properly. If you can't get to our event, take these items, pack them with materials that make them inedible, coffee grounds, kitty litter, anything, dissolve them in alcohol, and then bury them in your trash the night before trash, put them out to the curb, and get rid of them. Still not the best method, bring it down so we can incinerate it.
Dr. Jaydock, you have some perspective and some information on proper disposal as well, don't you?
Yeah, and just to echo some of what Frank was saying, we actually have over 30 sites in 7 counties now. I'm not sure, is that, oh, here we are.
No questions asked.
I'm just gonna... These drop-offs, if you haven't had the opportunity to come to one of them, they're very simple events. They're designed as a drive-through event to make it very easy for seniors, for anyone that can just conveniently come through. Now, as Frank was saying, this is the current New York State, under New York State law, should be posted at each of your pharmacies about the proper disposal. You don't want to put it in your waterways, not down the sink, not down the toilet. But as the disposal events, it's a drive-through event. A lot of them are set up at hospitals, community centers, and such. Law enforcement is always an integral part of it. Safety and security are not an issue. We have numerous vehicles come through, pharmacy students and pharmacists. At the drop-offs in Erie, Niagara County, we're actually counting controlled substances so we can just show what's being taken out of the community. And as Frank had mentioned, as licensed professionals, we all comply with HIPAA. So security, confidentiality is of utmost concern as well. This is just one. Anyone who's been at any of these events, you can see there are people bringing entire trash bags, and some cars have more than one trash bag. This is just an example of one person dropped these off. These are, they're not fentanyl patches, these are actually lidoderm patches, but this is just, you know, an example of one person dropping all these off. Either patients have expired, family members have expired, they stopped taking them. Sometimes there are some mail-order pharmacies or such that still keep sending them after patients have either expired or not taking them anymore. These boxes actually, they're shot from above. They're 3-foot tall boxes. They're filled, and you can see what's in there. And this is a typical collection. I believe this was at Niagara Falls site either last year or the year before. And we'll take anything, Sharps containers as well. And we just want to make sure that everything is responsibly incinerated. These buckets are all filled up, and then law enforcement will take them away. In this case, it was a Lewiston Police Department. DEA will be on site, represented at each of the sites, and then they'll be taken away to Niagara Falls. And from an ecological standpoint, what's nice is that Covanta Energy is donating this incineration, and they recycle this, anything that's incinerated back into steam and electrical energy. So, thank you.
And I know Dr. Jadok mentioned the uniform, which was of one of our local officers. We are here in Western District, New York. You may wonder, what is that? That's 17 counties. We do have the assistance of tremendous local, state, county law enforcement officials. I know it's been mentioned that there are some good colleagues and friends of mine here from Allegheny County who I had the pleasure of speaking with last week in Belmont, and they indicated they're having a drug drop-off. But Dale, just to give the audience some perspective, I know you've been overseeing the earlier drug drop-offs in terms of just round numbers, and I know those numbers are in the tons of pills. Can you give the audience some sense of what you've recovered?
Our last drug drop-off, Bill, which was in April of this year, we collected over 8,800 pounds of pharmaceuticals. 8,800 pounds, so more than 4 tons. We led the nation, by the way, in pharmaceuticals. Now, I don't know if that's as much to say that we have a problem here, or more to say that we have a really, really good group of people that have helped organize these events. We also have more collection sites than any other location. We have a network of law enforcement, community groups, treatment professionals. Everybody works together here, and that's why we've been so successful at this. So don't take those numbers the wrong way. I think it has more to do and is really illustrating the success of the mission as opposed to the depth of the problem here.
And for members of the public, if you need information, please call the DEA, call your local police. If there isn't a drug drop-off site in your area, ask for one. The police are very responsive. You yourselves may want to have a role in organizing one. I first met Dr. Lawrence over a year and a half ago because she was one of the instrumental people in bringing this whole drug drop-off concept to Clarence, and you actually had hosted that meeting, as I recall. And again, it's a matter of an active citizenry, sometimes helping us in law enforcement. Dr. Mylott hasn't had a chance to speak to you all yet, but the insurance industry is a very important piece of this solution. And Dr. Mylott, I know in my own case, I used to get a 30-day prescription. I actually know my doctor is here today. And then once upon a time, the script that I would go to the pharmacy with, I was suddenly required to take 90, a 3-month supply out. Can you tell us in the audience what exactly is the insurance company's role when it comes to authorizing scripts of a certain size? Is there any sort of tracking or accountability that your community can bring into this? Is there any reporting that can be done? What sort of recommendations would you have for all the things you've heard today? And I know you've been with us the whole day.
Yes, well, as a plan, as an insurance company, we have a unique perspective on this, and we actually take a very active role in looking at this problem. We're very, very interested in it, obviously, from both a clinical quality point of view as well as just a strictly utilization point of view. The utilization of these medications has gone up astronomically, as we've seen, demonstrated very well over the course of the day. So we can help with this because we have the ability to monitor and track the utilization of certain prescriptions for our members who are the patients of the physicians for whom these medications are being prescribed. The physicians only see what they are prescribing for their patients, and as we've seen, may not know what other physicians are prescribing. So we can assist in tracking, and if we see that multiple prescribers are prescribing the same or similar controlled substances, we can bring that information to the attention of the prescribers. They may very well not know that. And we do it in a confidential manner so that it's information that may be very helpful to a physician, giving him information that he may not have been aware of, and it can be useful in improving the quality of care that he's then able to provide to the patient. That can then allow him to improve the coordination of care. It can allow us, along with the providers, to identify people who may in fact be struggling with what may in fact be an addictive problem as a result of overprescribing or inappropriate prescription of narcotics. We can then use our resources and our knowledge of resources to help deliver or direct appropriate resources to a patient who may be addicted to narcotics or who may have increased pain management needs where they need specialization and the utilization of pain management specialists. So we have access to those various resources and we can help coordinate care. We also have the ability to improve the education for providers who, as we've seen today, frequently lack in specialized education about how to prescribe narcotics. So we try to bring that information and that education out to the provider community, particularly to the primary care physicians who, as we've seen, very often have no formalized education in how to do that best. They are comfortable with prescribing certain short-acting narcotics. They unfortunately have the ability they have the potential to become most easily addictive and often are the ones that are most easily diverted or abused. So we educate the providers. We go out to the providers' offices and show them other ways of managing chronic pain. We show them how to transfer patients to more effective long-acting pain management medications. So we do that on an individual basis in the practices, and we also offer annual educational seminars to the provider community, one of which is coming up actually on Saturday, November 5th, so I'll put a plug in for that. Dr. Updike mentioned that earlier today. But those are, I think, very much appreciated by the provider community because they really want to understand how better to use these medications so that they can minimize the problem that we've seen here today. They really don't want to be contributing to this problem. They want to be part of the solution.
And Dr. Mylod, just to follow up, this patient-specific information that would repose within the insurance industry, Assistant U.S. Attorney Lynch said that, and I agree, the vast majority of doctors, and you echo these, want to do the right thing. There's legal liabilities and duties of care and obligations that are imposed by law on the doctors. If a doctor is trying to do his due diligence on a given patient, maybe has some concerns, suspicions, do they call you? Do you call them? How exactly do you get together?
Well, it can be either way. Frequently, we are the ones who get in contact with them because we have the overview of the information. We can see how the prescriptions are being managed. We see where they're being prescribed from, who the providers are. We see what pharmacies they're being filled from. And again, that gives kind of the overview. So we can identify who the primary care provider is, and that's frequently the provider that we'll go to. And we can give them that information that this is a patient who seems to be accessing multiple medications from multiple providers, and they may have no idea of that. On the other hand, if a provider has a difficult patient, and some of these patients can be difficult, and they may really exceed the comfort level or the expertise of the typical primary care physician, they may reach out to us. And we have then the ability to draw on our resources, and we can then marshal our behavioral health assistance. We can marshal our pharmacy department, which is very, very good. We can direct to pain management specialists. We can direct to addiction specialists, such as Dr. Updike, and really provide the support and the resources that the physician and the patients need.
Thank you. We've had a number of questions, and I'll begin with Stacy Roeder, I think motivated by Samantha. But just from your perspective, you've worked now at Kids Escaping Drugs. You've probably spoken to thousands, if not more, of people that have fallen into this trap of prescription drug abuse. And a series of questions we've had include, what have the young people told you was, if there is any constant, was the most important or among the most important things that ultimately led them out of the addiction? Was there any one lifeline that they found was particularly important that perhaps parents could try to also offer before it gets to the point of addiction? And also, is there any mechanism to educate parents on some of these pitfalls and parties we've heard about and that sort of thing?
To answer your second question first, I think like many of us in this room, and we heard Jody and Yvonne and the speakers throughout the day talk about how this is a problem. It's a disease that nobody wants to talk about or admit. And just as parents believe that it will never happen to my child, all of the young people that have been on the Renaissance campus don't ever thought that it would have ever happened to them. You know, we work with a number of school districts. We partner with Dale and the DEA and a number of things. And I think one of the common things is when we have these meetings, we were talking to some of your other people here today, is that they will host meetings. And when I say no parent comes, I mean no parent comes. It's absolutely zero, because no one believes it's their problem. Where we have been successful is where there's a mandatory parent meeting, either for your child to attend a school dance or an extracurricular, or a mandatory parent meeting tied to student athletes. And a lot of those parents come kicking and screaming, but they all leave saying they have learned something. So I think that one of the things that we as a community have to do better is admit that this is a problem and admit that it could happen to any one of our children. Dale and I talk about this all the time. Our kids went to high school together and middle school, and our kids are all just one decision away. And for many of our kids, it started, Samantha shared that, it's really just one decision that sometimes lead them down a path that they could never have imagined, and we couldn't have imagined that as parents. So I think as parents, as I think all of us are in this room, or aunts and uncles, or maybe even grandparents at this point, is that we have to admit that it could be our child, it could be someone we love, and we can't just automatically look for another reason, because it can't be, because there is no reason why it couldn't be anybody in this room's loved one. As far as the kids coming into treatment and getting on the campus, most of our kids on the campus are court mandated. And that they get into the legal system usually where their addiction has taken because they're so desperate. You know, I asked Sam just a little bit ago, I said, at your worst, where did your addiction take you? How many pills? And she said 20 to 25, 10 milligram pills a day. That's 250 milligrams of medicine, maybe what, $5 to $10 a pill, times 25 a day. Nobody can afford that. And so a lot of our kids get involved in the legal system, and it's usually where we have those proactive systems, we have the police working with the courts, working with the treatment professionals, where we can get our kids into treatment. It's that leverage that we need to keep them there. As parents, you know, we feel our role is to protect our kids, and we're supposed to make things better, and we're not always the ones that can do that the best way. So sometimes it really does take the legal system to get involved, to say, okay, you need to do this for your own good, and if not, you'll face some jail time. And that's where we see most of our kids successful in treatment, is when there's that leverage standing over them to keep them there. And once we can keep them there for a few months, they normally get their heads clear enough that they realize they need this for themselves. But it's just that motivation to keep them there in the first place.
And just one question before we turn it over to Dr. Lawrence, who is in the school system, probably has a similar challenge with getting parents involved. For kids escaping drugs, or perhaps some of the other regionally based, Western New York-centric, Erie County-centric programs, what if somebody is from one of the outlying counties, say Cattaraugus County? We have people from all over New York State here, and some people from Canada. Are the programs in Erie County limited to Erie County residents?
Our program is not. And Bill, I'm going to let you address that more, because we take kids from all 8 counties of Western New York.
Yeah, on the Renaissance campus, we take children from all 8 counties of Western New York. It really doesn't matter what county you're in. I know sometimes it's difficult if you're in some of the rural counties, because sometimes the resources just aren't there. But please feel free to contact us, because if it's Lower Cattaraugus County, if it's Chautauqua County, Genesee County, Niagara County, Orleans, any county here in the Western region will serve your child. There's no limit to that. And also with our adult programs. Certainly when you're involved in more of an outpatient setting, where you're coming and going back and forth, there's not a residential setting, you might want to look for one closest to you in your area. Certainly because you'd be living at home, whether it's an adult living at home or a child living with their parents, they would come and go back and forth at the clinic. And if you need any access to locations, you can always access the OASIS website, New York State Office of Alcoholism and Substance Abuse Services. They have locations and types of programs available for everybody to witness on the site.
And there is, in fact, somebody here from OASIS who said hello to me during one of the breaks, so perhaps that representative, if he's still here, could make himself known. There. Yes, sir.
Yeah, I'm Charlie Morgan. I'm the Deputy Medical Director for New York State OASIS, and I can give you our contact information for the medical director as well, and if you email him, he'll always get you in touch with the right person or organization.
Wonderful. Thank you.